Turn the camera on, I know pay attention. People they sound like snorting coke or something.
That's all my life.
Okay.
Always the truth with Dr. Tieche. Hello, Cynthia Tieche here with Dr. Tieche.
Pause for a minute, like you didn't know who I was.
I forgot your name for a second.
Too much CBD water.
Too much CBD water. Well, oh yeah, it's right here. Right there. Yeah, we'll talk about that in a second. So, if I remember. How's it going today?
Wonderful, wonderful. I love the
Welcome
beautiful,
to my desk.
beautiful fall weather. Yeah.
Welcome to my lair.
Oh, I've been in here for several weeks.
Yeah, fall weather. So, you realize why I'm wearing this shirt, right? What? Did you not pick it up today? It's the day after Halloween. It's November 1st. I can wear my Christmas red now.
You're right.
And my nails are red.
I gotta say, that went right over.
A few other people noticed.
Who?
A few ladies in the office, other Christmas lovers like myself.
Okay, well, that went past me.
Last night when we were trick-or-treating, someone did not have Halloween decorations out. They had all Christmas decorations and two Christmas trees right at the front door. I was like, okay.
It's your kind of place.
I want to get on their level. Yes. It's a little early. I have not put anything out. You'll be proud of me. Yet. I might put my office tree up soon, maybe. No? When do you think it's appropriate to put Christmas decorations out?
The week before Christmas.
The week before Christmas? What do you think, Nico?
End of November.
End of November? It's a long time to wait.
I think you're not supposed to start decorating until after Thanksgiving.
Yeah.
After Thanksgiving?
Yeah. Like that weekend.
Yeah.
I don't know. I think everyone who watches this video should comment when they think it's appropriate to put out Christmas decorations.
More importantly, when's it appropriate to take them down?
That is a good question. Some people are taking them down right away, and some people, for religious purposes, leave them up until like February.
And then some people, for laziness purposes, leave them up till June.
So June, yes.
Anyway, let's get
Well,
on to something.
I like the holidays. And one thing I've been putting on Facebook lately has been get holiday party ready. Do you know what that means?
Yeah.
What? Yeah. Tell me.
Well, I think that you want to feel good and you want to look good. So I think that's an opportunity for people to start taking care of themselves a little bit more, start getting, whether it be facial, whether it be a little Botox or Dysport to help get rid of some of those wrinkles to look a little younger over the holidays, maybe a little filler, definitely some vitamin shots, vitamin IVs to feel better, help with that skin tone and texture. So, and really, honestly, really hormone evaluation too, because that will help one feel better and look better. So
Yeah.
kind of encompasses everything, actually.
Really, all of the above, yeah. Definitely, when you're going to the holiday party, especially if it's at, work, you've got to be looking your best. So, yeah.
Okay.
And hopefully, at the work holiday party, everyone knows that that's when you have to look really, really good. Right? No?
Apparently, I didn't know that.
I think it's the ladies. Maybe the ladies know. So, yeah, some Botox, got to plump their lips up a little bit.
Yeah, just like that.
Yeah, plump them up a little bit. Circling back, discussing decorations and holidays, I'd like you to know some of the comments that they made.
Yeah, don't just read the ones that favor you.
Decorate the first weekend in November, yes, and take down the weekend after New Year's. I am with you, Michelle. That's what I think. I mean,
Of course,
we could
you
ease
agree with
into
that.
it. Then there's some other ones.
That was probably more like what I said.
The week of Thanksgiving.
Okay, that was us.
The day after Thanksgiving, which I usually try to hold out till then, but
You don't try very hard.
yeah. I mean, why not just have 2 months of fun Christmas decorations? Yeah. I mean, this weekend we're going to be baking and watching some Christmas movies to get into the spirit of Christmas.
That's really cool.
I just take down day after Christmas.
Well, that's pushing. I can tell you that's pushing it in our house.
Yeah.
We haven't
Well-
picked up all the crap from the presents the day after Christmas.
Yes. But I'm pretty done pretty quickly after Christmas too. So what were we talking about? Before I got distracted with Christmas
Holiday,
again.
getting
Getting ready.
holiday party ready.
Well, weight loss is a big thing.
Mhm.
I always like to talk about weight loss because it's true though. Like, we got an amazing gift today from one of our downtown neighbors, Cindy from Mark's Prime, brought us a box of cookies like no other. I've never been given a box of cookies so
Elegant.
elegantly in this wood box that slid open and these amazing cookies. How could I not have eaten them? I had to eat them. They were amazing. So when you're getting gifts like that and you're eating, you've got to do something. So you've got to really stay on track on the days that you're not screwing up with delicious cookies, right?
Sure.
Yeah. So I say just save your calories for those gifts and those holiday meals and do your very darndest to be good all the rest of the time. And then, on those special occasions. We had another special occasion today.
Exactly.
We did. Oh, yeah. Yes. Our lovely team member, Nico, we celebrated today because he got a kidney. And so we had an amazing kidney cake made from Sugar Rush in Ocala. She does an amazing job making cool looking cakes. So I said, hey, one of our team members have been waiting for a kidney to be donated and finally got one. Can you make me a cake that looks like a kidney? She was like, heck yeah. So I did post that picture on Facebook. So if you're on Facebook watching, if you're not on Facebook, go look at Facebook. It's a pretty cool cake. It is a pretty neat cake. And we all did have a bite of that. So I've eaten a lot of sugar today. And I might be on a little bit of a sugar rush. Like Sugar Rush, the name of the place in it. Made the cake.
Okay.
So congrats to Nico because he got a kidney. Got a kidney. That's a big deal though.
What is it,
How
December
long?
18th?
December 17th or 18th.
I get admitted the 17th.
Okay. How long does it normally take to get a kidney donated for someone? Like, what's the process usually waiting?
Average is like 5 to 6 years.
5 to 6 years. How long would it take you?
11 months.
11 months.
Mm-hmm.
That's something to celebrate. That's
It is.
pretty cool.
It is. We probably need to get another cake.
Yeah, I'll probably do need to get another kidney cake. Yeah. Yes. So that was exciting news for us today at Recharge. So we have lots of really fun things to talk about today. One of them is this CBD water I've got sitting here. We want to talk about thyroid. I feel like we can never talk enough about thyroid, ever. It's such a problem. And if you do any research on it, you'll see. And I follow a lot of pages on Instagram for thyroid, and it's just very entertaining to see what's going on. Something else really exciting that I want to talk about, or Dr. Tieche really wants to talk about, is regenerative therapy that we are starting to offer here. Very, very cool, exciting, cutting edge medical treatments. We'll talk about that. What time do we go to break? We have 1 minute or 2 minutes?
Yeah, cool.
Oh, we have a couple minutes. Okay, so let's talk about the CBD water before we go to break. So, I guess we forgot to talk about this when we first got it. We've had it for a few weeks now. It's pretty cool. You want to tell them about it?
Sure. So CBD is extracted either from medical marijuana or hemp. So this CBD that is in here is from hemp, and so CBD is it's just becoming more and more and more popular. We try it on more and more things. Initially when it came out for pain, and that's what pretty much people used it for. But then people started trying it for anxiety, panic disorders, sleep, all sorts of aches and pains and things like that. And we're finding the more things that we try it on, there's a lot more people that benefit from it. The beauty of it is incredibly safe. It's all natural. You cannot overdose on it. There's really no side effects from it. People are using it topically in two ways. One, over areas that are painful, but also to help improve skin.
We're just talking about CBD in general,
CBD
not
in
just
general,
this water.
not the CBD water.
Right.
So anyway, the natural progression, most of the way people got it was through oil or capsules. And so now what's happened is someone had the bright idea of putting CBD in water. And so there's 30 milligrams of CBD in this whole bottle, which is kind of a average dose, it's not a tremendously high dose, it's a low dose. I wouldn't, the way most people have been doing it is they drink, a part of the bottle in the morning, part of the bottle in the afternoon, or, if they had gotten home and they had a bad day and had a lot of pain, they might drink the whole bottle at that point. So it does a couple of things. It hydrates you for one, but secondly, it's instead of it just being CBD that's added into regular water, it's added into alkaline water. So we know that alkaline water has a lot of tremendous benefits too. This one's got a lot of magnesium and other minerals in it. So that water by itself is definitely beneficial. And there are a lot of people that just go out and seek getting alkaline water with minerals because it helps with aches and pains and all sorts of stuff. So the combination of the two has really been really pretty cool, honestly. People that have been using it really like it. It works really well. And so you can actually kind of adjust the dose to what you want. If you're taking the capsules or the oil, typically it's got a dropper in there, so you can kind of get the dose that you want. Sometimes it's a little too much, sometimes a little too little, and it may not have the best taste. And here you kind of know it's 30 in there, it's going to be 15 for half. And so you can kind of adjust your dose a little bit easier in here. Secondly, it's water, so it's it's very palatable. There's no side effect, no side aftertaste is what I meant. No aftertaste with it.
Nice.
And so that's good because the other stuff is oil based. It's in either olive oil or MCT oil.
And
so
it's not bad.
It's not bad. It just has a little oily taste to it. But this is really just something else. It's another product. And I think people have been using it with a lot of success. I mean, a lot of people just drink some in the evening before they're going to go to bed, helps you sleep really well, helps aches and pains, helps kind of calm you down. Maybe half a bottle in the morning if you tend to be someone who has a lot of anxiety before work, school, or any of those things. It really has been calming people down. Not to the point where you're sleepy or sedated. It's not doing that. So that's a big perk because people are not, getting really overly sedated as they would with maybe if they took a Boost bar or a Xanax or something like that. It's a little too much. This is much milder than that and softer.
This is so much better than having to do that.
Yeah, so this is all natural. It's all plant-based. It's been around for thousands of years, and really we're just the dumb ones who are finally figuring out all of the uses. It's been here forever. People have been using it, and now we're finally opening our eyes to it and saying, hey, let's try it for this, let's try it for that, and that's kind of what we're doing, and that's really where it's been exploding. I think we're going to see a lot more products with CBD in it, and as the push gets more accepting and people become more accepting of it, I think it's going to be that way. So I think it's a great product.
Yep, it is. What I really love about it is just the fact that it is alkaline water and it's got all of these minerals. So really added benefit. We're going to go to a 2-minute break for the radio. If you're on Facebook, stay tuned. We will still be here with you. So if you're on Facebook, I want to continue talking about this a little bit.
So the other ingredients in here is calcium, magnesium, potassium, and sodium. So that's really kind of some of your basic electrolytes and minerals. And it's got a pH of 7.88, which is what we want in alkaline water. And so, aside from having the CBD in there, it's really kind of a pretty good just alkaline water on its own. So I think it's I think people who have some curiousness about that, I think should try it. It's pretty good.
So this CBD, I was talking to someone today about this actually, and we forget that people don't understand all of this exactly yet. Because the person I was talking to was like, I talked so fast, just like you did, about this is from hemp, it's not from medical marijuana, and they were still very confused about the whole thing. So THC is in medical marijuana, that's what comes up in drug tests, right?
Yes.
What is there THC in this CBD from hemp or any of the other products that we sell here, CBD from hemp? Do those have any traces of THC that would show up in a drug test?
Well, there's two questions there. Yes, they do. So the maximum
They have
amount.
THC.
They do. So the maximum amount of THC that is in hemp that's allowed to be sold over the counter at all is 0.03%. So it's a very low percentage.
And that's allowed to be sold over the counter
Correct.
from hemp.
Right.
Okay.
So it's basically considered a trace amount. Now, depending on the sensitivity of the drug test, which most of them are not that sensitive for minuscule amounts of THC, it's probably going to test negative. And so that's good to know because they're really looking for people who really kind of have pretty high THC levels. CBD is not a chemical compound that's tested for, so that's not something one has to worry about.
We're about to be done with break, but to just recap, this shouldn't have enough to show up in any drug test, but no one is allowed to ever guarantee that that's not going to happen.
Right, and yeah, I wouldn't, and I would think that it's going to also probably be depending on the severity. I mean, the strength of that test, how accurate that test is, plus probably in the proximity to when you're consuming it to the test. Probably if you drank a big bottle of water, right before that test, you're going to have a higher concentration because you just consumed it. If you drank it hours and hours ago, it's probably going to be what's left. That kind of thing. So there's a lot more variables that play into it. I think there have been a lot of people that have fought back and forth about if they tested positive. Most of the time, you're allowed to retake your test. And at that point, if it was pure THC from marijuana, it's not going to clear in a day or two. Usually the THC from CBD clears, so it's usually can rectify that situation that way.
All right, we're going to go back to the show in just a second. Okay, back with Dr. Tieche and Cynthia from Recharge Clinic in Ocala. We were just talking about CBD water that we're carrying, along with all of the other different types of CBD from oil and from that you can vape and capsules and all kinds of fun stuff. But we're going to move on. We do have this water. We personally love it. We think it's great. And you can probably find it online as well. But we're going to move on to some other things. I really, really want to talk about thyroid because there's just so much to talk about. So I put a post on Facebook about getting frustrated with weight loss, and we see it every day where people are doing everything right and they're still not losing weight, and they come in and we say, it's probably your thyroid, and they say, well, my doctor did look at my thyroid and he said everything was fine. We say, well, can we look at those blood tests? Well, the doctor only looked at TSH typically, sometimes T4, but there's more to it. We like to look at T3 and TPO. Why are we looking at these things? What are they? What does it all mean?
So if you look into the thyroid tests and the hormones that are involved with it, so from a manufacturing standpoint in your body, TSH, thyroid stimulating hormone, is a hormone that's produced in your pituitary gland and released. And basically, it's sending that to your thyroid gland, and it's sending at a constant level to produce a certain amount of thyroid. If it senses thyroid at a normal amount, it won't keep stimulating it. If it senses that thyroid is low, it stimulates more. It's like a thermostat. If there's plenty of thyroid, it will go down. So that's one test. Then there's what the thyroid produces, which is thyroxine, or T4. It's called that. It has 4 iodines on it. So that's the next level. So that's produced. And then what happens is that T4 circulates around your body, and at the cellular level where that's going in and starting to work, there's an enzyme that takes off one of those iodines called deiodinase, and it becomes the active form of that hormone, T3. T3 is the active form. So what happens is T3 then, there's lots of places for error in here. So what's happened in the perfect world, TSH should directly correlate with T4, should directly correlate with TSH. You should be able to say, okay, well, if I look at any one of those things, I should be able to pick out any one of those things and have a pretty good idea. And that is true in the perfect world. The problem is our bodies don't follow those rules, and particularly when there's other enzymes that are in between these steps, and enzymes that could be affected by multiple things. stress, environmental factors, allergies, antibodies, things like that, which is what happens at the cellular level with the thyroid enzyme, thyroid peroxidase. And so what happens is T4, people may have normal levels of T4, but can either have normal levels of T4 or exquisitely low levels of T3. And so what happens is their body is not even sensing enough thyroid. It's not, and so they're the ones who will have really symptoms of what we call hypothyroidism or low thyroid. And typically all those symptoms are low energy, fatigue, hair loss, dry skin, constipation, brittle nails, anxiety, difficulty sleeping, all sorts of stuff. And if you were to ask that person, you would find these things out, because they mostly spill their beans as soon as they come in and say, this is what I have. So what happens is if you just look at a screening test, and that's what happens a lot of times, people will just look at a TSH, and they will make a judgment based on someone's thyroid function based on the range that the lab gives them. They'll say, well, it is within that range, so you are within the normal range. Then they will take that same thing and say that about T4. You say your labs are within a normal range, which is a very misleading statement. So what that means, the person then, that doctor or provider is now telling you that there can't be possibly anything wrong with you because your labs are in this normal range. Well, normal range does not necessarily mean that is your normal. For what? Because these lab ranges were made over hundreds of thousands of people where they took high levels and low levels, and they saw where people would fall. And they said, okay, this is kind of what a low person has, this is kind of what a high person has, anything in between is normal. Well, we know that's not true. I mean, look at body weight, for example. You know, everyone knows that you could compare two people, same height, and their body weights might be totally different, body structure, muscle mass, all of that. But you can say, well, this is the range, but you're not going to say one person's fat, one person's skinny. You can't do that. And so we have to correlate these labs, you know, put them together with symptoms. So if someone has symptoms of that problem, most likely they have that. And it's to work backwards. You work backwards. You don't take, what they are doing is really working backwards. They're not listening to the patient at all. They're ordering the labs, they're looking at the labs, and they're making a decision saying, yep, your lab, the computer says your labs are okay, therefore you're okay. I don't want to hear anything about what problems you could be having. So, which is backwards. Even, you know, really doctors were not trained that way. They're going more towards that way now, unfortunately. But they were trained to listen to the patient, listen to their history, their symptom complex, and 90% of diagnoses are made by history and physical exam. That's well-known fact, and that correlate that with lab findings. So what happens is if I talk to someone, I already know if they're hypothyroid or not. I don't have to see their lab. But invariably, 100% of the times when they tell me that, I will see that one of their lab values is abnormal. And so it's kind of a backwards thing. So people are being misled just saying, well, your labs are normal, so you're okay. And then they go home and they still feel crappy. They tell their spouse or whoever, they say I'm okay, and everyone thinks, well, you're just crazy then. But the reality is, it's not okay, and you were just given some misinformation.
So that's when they look at the T4 and TSH and they see that they're in this range.
Well, they may even look at the T3.
But
there are
so
people
many
that
aren't looking at T3.
Well, sometimes they do, but I can tell you, I mean, on a daily basis, I'll have some patients that have T3 levels drawn, and they're in the low 2s, which is very low, and the provider will just say, yeah, that's okay. I don't know what that means, okay, because the patient is full of symptoms. So what is okay? I mean, is it okay because you're alive? I guess it is. But, you know, we're in the business of optimizing people's health, optimizing how they feel, not just saying things are okay. And you're right. Will that person continue to live? Yeah, they'll live fine. So I guess if that's what your baseline is, then it is correct. But if you're going to take that person and try and have them feel their best, then you want to optimize all of these levels. It's like a car. Can you drive a car that the engine is misfiring and not running right and burning a lot of fuel? Can you drive it? Yeah. Is it going to feel like a piece of crap and you're going to hate every minute of it? Yeah. But you can say, hey, car's fine. It's running, if that's what your criteria is. But if you have it all, you know, the engine has a tune-up and it's running much better, smoother, everything is better, the acceleration's better, everything's better. It's the same thing with all of our hormone levels. There is a spot, there is a number that everyone has that is right for them. And to make a generalization that everyone falls into this range and it doesn't really matter is incorrect, because over and over and over, thousands and thousands of times, I have taken those people's labs, moved that number up a small amount, and they go from feeling bad to feeling good. And so, if it wasn't true, that wouldn't be happening. And so
Yeah.
that is how it is.
Yeah.
And there's a lot of scientific stuff to back that up. I didn't make it up, and so it's there. It really just has to do with the amount of effort that people want to put into that.
Why aren't they
Well,
doing this?
interestingly, there's a whole lot of reasons why, but honestly, one of the things I think about is, well, there's one big thing is they're not really trained that well in these labs. They're taking care of high blood pressure, cholesterol, cancer, this, stroke, that, and so they're coming in and they see these labs real quick, and they're trying to get through 60 people that day. They've got 3 minutes to spend with you, and yeah, you're fine. Okay, you're not going to die.
Yeah,
You're not going to die on my watch. Next, I'll see you in 6 months. And so that's kind of one of the problems.
Okay.
Interestingly, that correlates with another article I was reading about the very high incidence of physician burnout. And it is super high now, more than it's ever been. It's about 70% of doctors, particularly in primary care, when questioned, say they're experiencing burnout. And what that means is they're frustrated, they have no energy, they're lacking motivation, they don't like going to work because of a lot of things that have happened in medicine. And so they've lost their joy to practice. And so they cited many reasons, and it's really been the transition of a lot of stuff. It's really been the intrusion of insurance companies dictating how we practice medicine, because most doctors inherently want to do the best they can for their patients. They want to spend time trying to figure out what's wrong with them. But when you work in an insurance-based system, the way you have to practice is mandated a certain way. This criteria, this criteria, this criteria, or else we're not going to pay you. And so basically you bend what you think is going to be an acceptable way of treating people to what they're going to do. And even though you say, well, it's not going to really hurt them, I'm okay, but it's not going to really benefit them either. And so what happens is they have those pressures that are controlling them. Then they have, the electronic medical records, which have been, you would think, a big help, but it's not, because what happens is the insurance companies now have made all of this criteria, particularly Medicare, they come up with a thing what's called meaningful use. It's meaningless use. It is the stupidest thing ever invented. But what they want people to do is fill in all these blanks on everybody. And if they miss one little blank for something that's totally irrelevant, they're not going to get paid, or they're going to get a small percentage of what they get paid for taking care of that patient. Most of the time, it is totally irrelevant. It's like, how many bowel movements have you had? This, that, this, that. I mean, it is a stupid checklist. I had to do it many times. You just are so infuriated that you have to do it all the time because it's not relevant to what you're doing. And so, but they've mandated that, they've passed it into law, so now people are required who are going to work under that system to have to do that. So they're spending most of the time doing all the checks, doing that thing, spending very little time talking to the patient. It's typically the average amount is less than 30% of the visit is spent looking at the patient because they're trying to enter all of that data and do it correctly so they don't get penalized. And so what's happened then, reimbursement has gone less, so the amount of money they get per visit has gone down. So they're on a treadmill. They've got to do all this information very quickly, have to meet all of these criteria so that they can get paid by the insurance company, who is now telling them how to practice, but yet they got to do all of this to do it correctly, but then they got to do it a lot of times a day. So where does that leave the patient? There's no interaction between the doctor and the patient. It is trying to fit all of this together, and who suffers? Well, the doctor suffers too, because he hates doing this, he doesn't want to do it, his hands are tied, and the patient suffers. And so they've won, and it's a very frustrating thing. And so every year that number, there was a graph that I looked at about physician burnout and physician dissatisfaction. It goes up by 10% every year. And they did a study with doctors who were just finishing their training. More than 50% who had just finished their training regretted that they went into medicine already.
Wow.
That's pretty sad. That's pretty sad because, they have all this, and it's got nothing to do, 99% of them had nothing to do with taking care of patients that were sick. Not one of those things, but I don't like taking care of people that are sick. I don't want to listen to that. No, it was everything else. It was dealing with insurance, electronic medical records, being told how I have to practice, things like that. And so those are frustrating things because you're trained one thing, you're trained to do this, but then you have to do the other. So what happened is all of your care gets compromised. So in a way, I'm a little defending some of those guys, but it's still not right. They can still do a better job. But that's a big problem. And what's happening is that's going to get worse because they start ratcheting things down as insurance companies become more powerful, as Medicare implements more rules to be able to reduce reimbursement, something has to suffer. And so it's going to be the doctor-patient relationship.
So they're not getting the proper training to to take care of thyroid and hormones.
No, no one does really, honestly, in their training.
And they don't have time to think about going and getting that.
Well, it's, it's not that I don't think that it's a high priority. They're trying to figure out everything else. They're still trying to stay current with everything. And it's pretty much, they're just trying to, machete through the jungle as far as taking care of sick, not sick, sick, not sick. That's kind of what they're doing. And so, do you have a life-threatening illness? Do you have something that I can majorly prevent, like uncontrolled hypertension, uncontrolled cholesterol? No, yes, okay, you're in that category. You have something that's just what they perceive to be a foo-foo problem. I'm tired. I can't lose weight. My back hurts. Those are things that are not perceived to be real problems, because when they compare them to these other problems, they're not. So they have much less weighting in their mind, and so much less time is spent on it.
I see.
But these are all quality of life issues. These are true life issues, but they don't necessarily have to be separate. And really the main thing that you want to think about is they've done a great job of extending life. That part's good. But now we've got people who are living longer who feel much worse. So we got to improve that portion. That's where thyroid is a huge thing. I mean, more than 50% of the population in one study, more than 50%, so that's every other person, is clinically hypothyroid. In other words, they have symptoms of low thyroid, low temperature, hair loss, dry skin, difficulty with weight loss, fatigue, all of that kind of stuff. That's a lot of people. That's a lot of people that are getting passed on and are feeling miserable and can't understand
And being
why.
told, you're fine, just get out of here. I mean, I think by the time that they get to us, they are so done. They're depressed. Depression is a symptom, isn't it?
It is.
Dry skin. What I've always thought was a shocking one is sensitivity to cold. Brain fog.
Well, the sensitivity to cold really makes sense when you think about it. One of the things that thyroid affects.
Well, people just think immediately it's hair loss and weight gain.
Well, no,
But there's
but
so many other symptoms.
Well, think about it. There's a lot of practitioners who measure patients' temperatures, and that's a very good estimate of thyroid function. So, the normal temperature is 98.6, but there's a lot of people who feel cold all the time. Guaranteed, if you took your temperature on a daily basis with a digital thermometer, your temperature would be much lower than that, 96, 97. Why is it lower? Are you dead? I mean, what's going on? Why isn't it in that normal range? Well, because your thyroid is hypofunctioning, low functioning, or that enzyme conversion is low. And what's happening then is it affects your metabolism. Well, your metabolism is the thermoregulatory thing. It's the temperature control. So people tend to feel colder in rooms. They tend to, that kind of stuff. They're really sort of almost in a state of hibernation.
Wow.
So it's real.
Packing on fat.
Yeah, so it's real. I mean, we did that on some patients. We would measure their temperature and treat them until their temperature became normal. And you see that over and over again. So it's a super common problem. And the thing is too, now there's much more variables that affect thyroid too. Lots of environmental stuff. I mean, drinking out of plastic bottles and all kinds of stuff, and all the other toxins that are in our foods and in the environment, and pesticides that are in our food. Those all suppress thyroid. That thyroid enzyme is very suppressed by stress. And usually, if someone's had a stressful life event, something happened. It could be a birth of a family, it could be a death of a family member, something bad, they got a divorce, they had a car accident. They'll say, wow, after this event happened, I started gaining weight and couldn't lose weight. And that happens over and over again, where you'll hear people relate it to some life event and then it changes. So that's something that is a very common problem.
Options are there? So a lot of people ask, okay, so what do I do? And do I have to go to a doctor to fix this? And will it go away?
Well, the goal is ultimately to try, if it's just that enzyme that's inhibited, in many cases that can heal itself, but it does take time. It takes time with, a better diet, exercise, things like that, less stress, giving that thyroid the certain precursors that it needs to function properly, like iodine and selenium and chromium and things like that. The problem is it's not always a quick fix. So, will it take a month? Will it take, a couple of years? Will it take something? I don't know. Everyone's different. So in the meantime, then what does that person do? Do they suffer with those symptoms? Do they feel crappy? Or do they go on some medication for a short period of time to help improve the quality of life, improve their mental clarity, improve their energy level throughout the day, improve, their ability to lose weight? I think that's what they do.
How often do you see people go on something for this thyroid and it goes away? I mean, is that often? Don't a lot of people need to stay on it?
Well, some people do, but we have had patients who, after being treated with the thyroid and their hormones and supplements, a year or 2 years later, we reevaluate them, and their labs are in the normal range for thyroid. And so it is not uncommon, it's not unheard of. So there are people that come back off of it. I don't know that everyone does, but I don't want to say that everyone does come off of it, but a lot of people do. And so, but I think that it's a multi-pronged approach to try and fix the problem. It's not just one thing and then it's going to be fixed the next day. It's just not that simple. So
how long can it take to really help someone feel better or get through these symptoms after they start thyroid treatment, and whatever treatment that might be? Is it like next day you're there, or is it months?
Well, that's a variable answer because everyone responds a little bit differently to the thyroid medication. If you go by what people suggest, they're going to say that it takes several weeks really on thyroid medicine for people to notice a change. I'm going to disagree with that. I think people feel differently much quicker than that. The problem then is if someone is really low and they're having a lot of symptoms, they will feel a little bit better once they start thyroid medication, but they're not going to feel totally where they want to be. So it takes a series of adjustments. We tend to do it pretty rapidly. There are some people that do it even more quickly. Some people adjust patients every other day with their medicines. That's a pretty aggressive form. We advance them like every week to 2 weeks, increase their medicine until they start to feel better. And they will all of a sudden say, okay, at this dose, I feel good. I am not falling asleep in the afternoon. My hair has stopped falling out. I am able to walk into a room and remember why I went there. So each person is going to be a little bit different to adjust, but generally within, anywhere from 2 weeks to a month, we can probably find that correct dose that they need to be on. So it's it depends. I mean, if you think a month is a long time, then it's a long time, but in the scope of how long most people have been putting up with it, it's a really quick problem.
Yeah.
I mean, a really quick time period.
Yeah, for sure. So does this have to be done through a doctor?
Well,
Can
yes.
you do this on your own?
Well, the only thing that you can do on your own is there's a lot of thyroid supportive supplements that you could take. You could buy them, in vitamin stores and online and stuff like that. But that's only going to really help you in your mildest form feel better. And so the problem with that is if you have really no idea how bad it is, but there's no gauging by the symptoms how depressed your thyroid is. So, it's worth a try to try those things, but I can tell unless we've kind of looked at it, we don't know what that's going to work. So that's really the only over-the-counter way you can do it. I would not self-medicate myself with thyroid. I'm sure you can buy it online somewhere. I'm sure you can buy it from Canada or overseas. We've had some people take horse thyroid, cow thyroid medicine that are farmers who tend to treat themselves with those kinds of medicines. I don't think that's the best choice because they really don't know the dosages. And so, it's something that you can really hurt yourself with if you overdose. And so we want to do it properly. I mean, we want to fix these things, but we want to do it with, some caution. I mean, I'm probably more cautious than some people, and I'm fairly aggressive. I like to go quickly, but I rarely overshoot anybody. I mean, and so I don't want people getting symptoms of having too much thyroid, which would be jitteriness and racing heart and things like that. And then if they do, it's very easy to back it down because the symptoms only last for a day because that's how long the medication lasts.
So let me ask real quick. We have to go to break in just a minute, but we see a lot of people that come in and they're on levothyroxine and Thyroid most of the time. Is that T4, both of those? Or
Yeah, it's the same thing.
Those
It's just brand names.
just
and
different brand names.
name and then
Those
what's
are T4 to treat your T4, but what if your T3 is low? Will those work?
No.
So,
well, no. Well, the answer is partly yes, partly no.
okay.
In the people who just have a low production, so there are some people who their thyroid just does not produce a lot of thyroid, so their T4 is low. And that enzyme may convert normally to T3. So it is worth a try to give them some T4 to see. Now, if their T4 comes up to a normal level, but they still are fatigued and you check and their T3 is low, that means they're not converting. They mean they have a trouble with that enzyme. And those people, they're not going to continue to respond. So, but there is a small subset of people who do respond to that. So I don't want to say that it's never the right treatment, but it's not always the right treatment.
So if you're on those and you're still feeling bad, you probably need that T3.
You could.
Okay. Well, we're going to go to a break for the radio, but for Facebook, we go to break at 3:40. For Facebook, we'll still be here and continue talking.
You can see when it's on.
Oh, yeah. I figured. So during this 2-minute break, I want to continue talking about thyroid, or this, because when we come back, we're going to talk about the regenerative therapy. So for someone who might be on, I'm asking this because I know so many people come in, they're like, yeah, I'm on levothyroxine, yeah, I'm on Synthroid for my thyroid, but they have all of these symptoms. It's because no one ever looked at their T3, or maybe they did, but they never treated their T3. So that must be the missing link for these people, because I feel like almost every person that walks in the door is on levothyroxine or Synthroid.
Well, it's more complicated than that because, unfortunately, when doctors are uncomfortable doing something like thyroid or even hormone replacement, they start people on a very low dose and then they just forget about it. They don't want to deal with it anymore.
They don't recheck and reevaluate.
And so they don't really reassess. Listen, I put you on a medicine. The logical step is, next visit, is that medicine working? Well, we don't ever do that, so they don't ever do that. And so what happens is these people are on the same dose of these medicines for year in and year out. They just go, dutifully go get that. No one wants to stop it. No one does anything. No one wants to change it. So we don't really know if it's working. So it could be two things. It could be one, that dose of Synthroid or thyroxine is not enough. They might just still have a low T4 level. That's one. So by checking it and asking about symptoms, they would find that out. Secondly, it could be that that number is okay, but they're not converting. The only way to know is two things: talking to the patient and checking the lab. Most importantly, talking to the patient. That's going to give you your most information. So we see the same thing, unfortunately. I know when I'm talking about this with estrogen and testosterone in men. They will go and someone will put them on estrogen or put them on testosterone, and really, really teeny doses. The patients will get no benefit from it. But when they go back and they say, I don't feel any different, like, well, I put you on it, you wanted to be on it, so you've gotten it. And so what happens is the patients get so disgusted, they stop asking about it. They generally stop taking it because they're like, well, I tried it, it didn't work, so that stuff's crap. But really the reality is they were never really given the proper dosage of it. And, and so that's part of it. So it falls into a lot of hormone therapy, not just thyroid. It's everything. People just kind of just throw a little bit out there and they say, okay, I've treated it, now leave me alone with that. I don't want to hear any more about it. But the reality is, let's kind of fine tune them. And so that's the problem.
All right, we're gonna go back onto the radio.
Okay.
And we're back. Cynthia Tieche here with Dr. Tieche from Recharge Clinic in Ocala. So we had a long discussion about thyroid and T3 and all of that fun stuff that many people have symptoms from. But we're going to switch gears into another topic that's pretty exciting, pretty cool: regenerative therapy. So remember, Dr. Tieche, we don't have much time. We're in our last segment here. I know this is a huge topic and a lot we're not going to get to, but we can continue. We can take questions.
So regenerative therapy really encompasses a lot of stuff. Really, it encompasses hormone replacement as well. And really the idea behind it is to rejuvenate us back into a more youthful state and really prevent the signs and symptoms of aging. So we already talked about that kind of the thyroid. We already talked about it a lot with testosterone and estrogen and things like that we do, as well as things like growth hormone, stimulants like GHRP2, as well as growth hormone. Okay, so that's said. Now, there's a whole other branch. There's things that are used to help pain, which are things like PRP, platelet-rich plasma. That's where we extract your blood, spin it down in a centrifuge, and harvest the platelets. The platelets have all the growth factors, healing factors, and things like that. And we use those as a medicine to treat yourself again. We inject it into joints that have ligament and tendon injuries. We can inject it really lots of places. We can use it for erectile dysfunction. We can use it in women for urinary incontinence. We could do it for aesthetics. What it does is it causes, it deposits those growth factors there, and it stimulates a recruitment from your body to really bring in a lot of other stuff to start healing these areas and help regrow them and cause something good to happen there. So it's happened one step further now. That was kind of the initial thing. So then people went to other ways of getting these growth factors. And so there's a lot of ways of doing it. There's trying harvesting cells that yield much more growth factors. So we know that that does it. So we've gone for other things. People are doing stem cell therapy, and people have probably heard that, where they're harvesting pieces of bone marrow or fat and treating them and working them up there and extracting those products as well, and then re-injecting them in there. But now there's a whole nother line. There's stuff that's taken from amniotic cell membranes. There's stuff that's taken from amniotic fluid. But more importantly, there's stuff that's taken from amniotic, the inner lining of amniotic membranes, which is what the placenta is. They're taking these cells out because these cells are the ones that have the most healing factors and growth factors in them, and they are harvested and they are grown. And then right at the time when they're starting to do something, they are stopped, and all of those growth factors and healing factors are taken from them. And they are like 100 to 200 times more factors in there that are available in PRP.
Wow.
Yeah, so these things are isolated, and here's what a box of it looks like. And basically it's, one of them is axial bile fluid, and basically it's a liquid preparation that's meant to be used with PRP for joint injections or erectile problems and stuff like that, because it's delivering so much more growth factors, and it can be used in an intravenous form as well. And with
so NIVs.
in an IV, you put this in an IV, and it helps lots of symptoms: joint pain, fibromyalgia, certain types of arthritis, anti-aging. It is incredible stuff. This is going to be the future of a lot of things in medicine. Wow. We're just going to see more and more products like this come out. The product is safe, even though it's harvested from amniotic fluid. It basically doesn't have any antigens. And what does that mean? There's nothing on these proteins that would cause a sensitivity to a person. So that's been out. There's been no reported allergic reactions. When they first started doing it with amniotic fluid and things like that, people had some reactions to it. But this is very,
and this
very
is
safe.
not from amniotic fluid. This is from amniotic cell membrane.
The amniotic cell membrane, the inner lining, the mesenchymal cells that are in there are harvested, and then the factors are extracted out of that, and they are very concentrated factors. And so it's really, really exciting stuff, really, because I really think that people are going to get a lot of benefit. Other places where it's being used, they have been using it for lots of stuff like fibromyalgia, chronic pain, just energy, all kinds of stuff, and people are having really excellent results with it. And so that's something that we're going to start offering here as an intravenous form, but also as an injectable form. Either way, we're going to, the injectable form will probably add with the PRP, the patient's own PRP, and then
so give
for the
me some
intravenous form,
examples.
you won't.
So using it as an injection form to regenerate torn ligaments and knee injuries and shoulder injuries and tennis elbow, things like that, right? This is also used in wound care.
Oh, absolutely.
We don't do
wound care, but there's a lot of, that was one of the ways that it came about, was wound care. So people who have maybe diabetic ulcers or arterial ulcers, they have these big sores on their legs. It's used in intensive care units to stimulate growth for people who have burns. And what it's doing is when they apply it either topically or IV to those people, and since we're just getting so many healing factors and growth factors, that it just really accelerates the healing. So big wounds that would take years to heal and never go away are dramatically closing up in a period of of weeks. And so that is exciting stuff.
That's so cool.
Yeah.
Very cool.
Yeah.
Why would someone put this in an IV?
Well, I think that anybody that cares about anti-aging and has lots of symptoms that really, we are not able to treat,
Like fibromyalgia,
Lyme's disease, things that COPD, just stuff that we want, because there are clinics that are treating COPD with IV stem cell, IV PRP, and lung problems, and they are having benefits. Even cardiac stuff is having benefits from that, because it's kind of going to these areas and causing just rejuvenation, all of these places. Now, it's not going to take you and make you a 20-year-old again, but all of these things are additive. I mean, people are doing, dieting and exercising and trying to increase these factors
So this is like that top level of.
Right now, this is really out there. This is kind of the Mac Daddy of stuff that's being out there, and it's available. These factors are super high levels, and they are able to do a lot of stuff. So it's,
Wow.
Yeah.
Wow.
Topically, you can use it for, like we were doing the PRP facials. We can use that topically with the microneedling as well to cause much more collagen growth. We can inject it under the skin and do the same thing in your face to stimulate much more
Could that
collagen.
be used as like a dermal filler or with a dermal filler?
Oh yeah, with a dermal filler for sure. Just like we use PRP. It's exactly the same thing. You just use it. Whatever you can use PRP for, you can use this in addition to being able to give this intravenously to get that stuff, to get those added benefits.
Wow. Wow. And so this is safe. This is.
Yeah. There's not been any reported reactions. It's been used on lots and lots of people. It's been used in lots of burn centers. It's been used on lots of trauma centers. It's been used a lot of times on outpatients for topical use. It's also been used intravenous use, and a lot of regenerative centers that are using this. We're not the first. We'll be the first here locally to do that, but we're not the first one to do this for sure.
So, famous question. Does insurance cover this?
Yeah.
Yeah, we're not going to go there. Of course,
You can pretty much say no.
they're not going to. Very cool. I like it.
I'm very excited about it.
It is exciting. It's exciting. And I don't think anyone around here is doing anything like this. And so, did you mention putting PRP in IV? Did I hear you say that?
Yes.
Is that something that people do also?
No. Well, yeah, they are. Yeah,
Alright.
there are some clinics that are using PRP as well as stem cells and injecting it IV
Wow.
because they want those factors. Well, this is one step higher than that. So this is a multiple steps higher than that. So this sort of takes that and see, the problem with PRP is we're using your own blood. So ideally, the factors are probably their best when you're in your 20s. Unfortunately, as we get older and we're starting to have all the problems, probably some of the factor levels have gone down, even though we're concentrating them. So the PRP is not quite as effective as when we were 20. So it's kind of that part. So we're looking for ways to
So it's good, but it could be better.
Right, we're looking for ways to really ramp up those factors and cause a lot of benefits from that. And so that's one of the ways that we're able to accomplish it by adding this. It's a very similar analogy to taking vitamins. We give IV vitamins because we want to give a very high dose of them. Yes, we could eat carrots and broccoli and all of that and get that, but we're going to get a very high dose of that. This is very similar, except we're using all of these growth and healing factors and regenerative factors, and we're just giving you that either topically or intravenously.
Wow. So what other illnesses does it help with? We mentioned COPD, fibromyalgia, Lyme's disease, and this is via IV.
Yeah.
IV therapy. What were some other ones?
It helps a lot of chronic conditions for sure, a lot of chronic joint pain, things like that.
I have a list of them. I was reading, cerebral palsy, MS.
I'm not going to make any promises about that, but people are using it for that.
And so anti-aging, how does it help with anti-aging? Like what would that do for someone getting this IV?
Well, I think it's going to do the same thing that everything else does anti-aging. We are trying to provide substrate for our body to heal itself. We're trying to use these factors to go into areas that have definitely been weakened, have been attacked, have been lost structure, and provide these compounds that your body would normally produce to heal these things. And so what is going to go there and cause, it's going to cause more collagen production. It's going to cause, your skin to look better. It's going to just help you feel better. And so that's really how it's going to do all of those things.
That's pretty cool. So this is available now?
It is.
Available for injections for joints, available for IV therapy
It is.
here.
It is.
And you'd be the one performing all of this
I would.
fun stuff.
Mhm.
So you're excited about it?
Very.
Cool. Very good. So that is new to Recharge Clinic this week, and probably new to Central Florida. So that's all we're going to talk about today because that's all the time we have. RechargeOcalaClinic.com is our website. This information for this particular new regenerative service is not on our website yet, but it will be very soon. But a lot of other information is on there. You can get a hold of us, ask questions from our website or Facebook. And that's all we have. You have anything else to say? No? All right. So we will see you next week. Same place, same time.